Fighting the flu. We've been telling you the last several weeks about the growing numbers of flu cases around the valley. Local hospitals are now seeing so many patients, they have been forced to find additional space to care for them. 27 First News reporter Gerry Ricciutti has that story.
Valley health experts tell me they knew the area had fallen under the state's flu epidemic just before Christmas last month.
It seemed to calm down a little bit, and then right after Christmas, we again had a huge influx of patients, and that pretty much has continued since.
So much so, officials had to take extra steps to ensure there were enough available beds.
We've opened an extra floor here at St. Elizabeth's to accommodate the extra flow of patients, inpatients, and we've also opened an extra floor at Boardman.
But we definitely have had to make similar arrangements here.
Northside's chief of medicine, Dr. Paul Rich, tells me he and his colleagues have been treating a steady increase in flu patients the last several weeks, both at the hospital as well as in their offices, perhaps 2 or 3 times as many as they've seen in past years.
I probably personally this year has prescribed more Tamiflu this flu season than I prescribed in the last 14 years in practice combined.
While Dr. Rich admits there have been problems with the effectiveness of this year's batch of influenza vaccine, he says those who've been putting off getting a shot, thinking it won't do any good, still have time to get one.
Certainly 40% effectiveness is better than 0.
Both men tell me those most at risk from this season's strain, including the very young, the elderly, and those with chronic illnesses such as COPD, should be proactive in getting to the doctor if they get sick. They're also warning anyone suffering with a fever, headache, muscle aches, and a nagging cough for more than a day or two.
Symptoms that persist, they need to contact their physicians.
In Youngstown, Gerry Ricciutti, WKBN 27 First News.